Welcome, everyone. This is Kevin from the Year Lab podcast. If you're new here, every week we invite fascinating guests to cover the topics of investing, entrepreneurship, and well-being. Our guest today is Bradley Campbell, a holistic physician who is Robin Hooding the healthcare back to the masses. In other words, you're helping people become their own best doctors. In this episode, we'll Bradley Campbell talk about how the pharma industry and the current medical system work, Western versus alternative medicine, mental health. We'll talk about focusing on healing as opposition to focusing on the disease. And then at the end, we'll talk about some tools, techniques, foods, and herbs to help you heal from within. Ladies and gentlemen, before we start, don't forget to subscribe to our channel and turn on the notification to never miss one episode. Also, keep in mind that nothing shared or discussed here is medical advice. So, Brad, why don't we start with some context about your background? So what are the key turning points in your life that define who you are today and what you're doing?
The biggest turning point in my life was a medical injury that happened when I was 9 years old. So in fourth grade, growing up in elementary school, I was doing gymnastics outside of school. And my dog is going to be loud here. He's begging for a treat. So I'm going to give him a blueberry. But basically, fourth grade, I was in school. I was flipping off of desks with my friends, doing front flips and back flips. And I slipped and hit the corner of my head on the corner of a really sharp desk and ended up in the nurse's office. And I blacked out, basically was trying to make my way down to the nurse's office, blacked out, and ended up going to the hospital. And I had to miss a few days of school because I had like headaches, couldn't sleep super well, was super out of it. But the problem was for 9 months afterwards, I lost half of my IQ and most of my short-term memory. So I went from a grade ahead in school to a grade behind in school. And I didn't remember who I was. I didn't really have deep emotions. I was just kind of like flat, numbed out, didn't feel like myself. I started getting bullied in school for being the stupid kid. And my sense of identity was basically gone. And I went to 20, 30 different medical doctors and practitioners and some of the best teaching hospitals in the United States, and had CAT scans and EEGs and sleep studies done, and no one could figure out what was wrong with me. And after 9 months of trying all of those different things, being super well connected because my parents are in the medical field, super well connected to the best practitioners, I happened to be sick from school one day, and my mom had been in a really bad car accident. And so she took me with to her chiropractor appointment, which was a referral of a friend kind of thing. And she brought me with because I was sick and had a cold, and was just like talking to this chiropractor and said, my son has been really off the last 9 months. He had a terrible concussion. He's just left for dead by the medical establishment. We don't know what's happened or what to do, but he's really struggling. And the doctor was like, let's just use some of my lunchtime. I'll skip my lunch, look at your kid. Let's see what's going on. And he was the first person in 9 months who just touched my head. I had not actually had one of those dozens of doctors actually just do a physical exam to see what was going on. Turns out I had a dent in my head the size of a golf ball opposite where I hit, because your skull doesn't fully fuse until you're about 20. And we know babies, infants have misshapen skulls and craniums, and doctors will do cranial adjusting or cranial manipulation to readjust their skull. But basically the sutures, like geographic tectonic plates, had shifted and pushed inwards opposite where I hit. So in the back corner of my head, the actual cranial sutures were pressing inwards and putting pressure on my brain. I still have the CT scan. You can actually see it, but most Western, at least American doctors, don't look for that on anyone above 2 years of age. So he was the first person in 9 months who touched my head, found that I had a dent in my skull, did cranial adjusting to basically pull some of those sutures apart, like some craniosacral practitioners do, or osteopaths, DOs, doctors of osteopathy in the US will do this. So he pulled the sutures apart, took the pressure off my brain, and within 1 hour, I was completely back to normal. It was like someone turned the dimmer switch back up. I laughed for the first time in 9 months. I went from a back to a grade ahead in school. It was a miraculous healing that profoundly shifted my entire sense of what was possible in modern medicine.
Wow. But so basically you said you were 9 years old. So now you're about 10 years old. So what happened in the next couple of years? Is this experience basically making you decide to study some kind of medicine, or what's happening?
So not really, because my parents knew how profound that experience was. But at 10 years old, I didn't really have that much awareness of what's normal. I didn't know, oh, that's a really weird miracle healing. But I knew that it was special, and I knew that it changed my life. And I had a couple other concussions through high school where the same doctor was able to help me out in just one visit, where I tried medicine, I tried other stuff. I'd kind of whiplash and reconcuss myself a few times, and he was always able to help me. So I had multiple experiences with chiropractic kind of coming in and making huge differences for me in terms of how I was feeling, or headaches or nausea and stuff like that. I didn't really want to become a chiropractor, not for a while, because I was super into music. My grandpa was a saxophone player and got to play with Count Basie's orchestra and some of the greatest jazz people of all time. And he was one of the first people to start a jazz program in Central Illinois at a college. And he taught me saxophone from an early age. I was super into music. I was doing jazz band and marching band and classical music, and I was learning the flute and clarinet and a whole bunch of other stuff. And so that was what my love through middle and high school. And I was still considering doing medical school. So I basically went to college for pre-med and for music, not sure which one was going to be the way I would go. But I fell in love with music in college and really was going down that route. But it turned out that I didn't really love sitting in a practice room for 12 hours a day, because classical music especially is very isolating, and you don't really get to make a huge impact on other people. So you're alone all the time, sitting by yourself, like honing your skills. And then once every month or so, you go out and have a concert and you get some people to come. But jazz was great, but I was more in the classical music path. And so I realized I wanted to help more people than I could through music. And I wanted to just have more interpersonal connection through my career. And I went to some job fairs, and at the time I was considering doing medical school, because I was like, this is really cool. This chiropractor helped my life, but I'd shadowed other natural healthcare practitioners who were either a little bit more snake oil salesman type, or they were a little bit more like the chiropractors who you have to see 3 times a week for 3 months and twice a week for the rest of your life. And I'm like, I don't think that's really necessary to have people spend $50 or $100 a week on getting their back cracked, even though it feels great. And I saw the changes that people would come in with a cane and walk out of the office without a cane. That was profoundly awesome, but I didn't love what I saw in most of the chiropractic profession. So I was going to become an MD and basically go to med school to be a surgeon. But every surgeon I talked to had a really poor work-life balance. They were either divorced, they were on psych meds, or they just weren't super happy with the 12 years of school they went through. And when I talked to every chiropractor, every naturopathic doctor, they loved their profession. They were super head over heels over their job, their career, their life. They loved their kids. They loved their wives. It's like, this is great. This is exactly what I want to do. But I just want to do it the way I want to do it. So I was decided to go into that profession knowing that I was going to spend more time with people, that I was not going to just be in and out in 5 minutes a doctor, and just do it a different way than a lot of the profession has done it for the last 30 years.
And when you mean a different way, you mean by basically talking to people online and growing socials, or you mean something else?
Totally different. Yeah. So I really got into chiropractic and naturopath. So got into chiropractic school knowing that I was going to just do a different style of doctoring than most chiropractors, because most chiropractors will do what's called high volume practice, where they try to see as many people as possible, to adjust as many people, to help as many people, which is a really great style of practice, but it wasn't the type that I wanted to practice. I wanted to really get to the root cause. I wanted to spend half hour, an hour with people to really do deeper levels of healing and awareness. So more of sport rehab, or more of helping. I wanted to help injured musicians like myself get to the root cause of where their structural issues were coming from, do some movement evaluations, maybe do some diet and lifestyle evaluation, do more counseling and coaching with them, almost more of what naturopathic medicine docs or health coaches do. And so I got into it knowing that I wanted to do that style. When I got into school, I got super addicted to school and taking seminars, and I took 120 seminars in 4 years on the weekends. So I was basically doing chiropractic and naturopathic schools and doing all these seminars on the weekends. And I just through my whole 20s, I'm 32, almost 33 now, but I basically spent all my 20s doing as many trainings as possible. So I did chiropractic and the naturopathic school. Then I went to acupuncture school. Then I was working on finishing 5 degrees in nutrition, neurology, homeopathy, internal medicine, and applied kinesiology, to basically try to learn everything I could to help people, because I just got addicted to learning about natural medicine, trying to find out what was the root cause, and trying to really, for my own like ego, trying to figure out how Eastern and Western and Ayurvedic medicine all integrated, because I was super skeptical of natural medicine getting into it. Like I thought supplements were bogus. Vitamins probably didn't do anything. Organic didn't mean jack shit. And I really started to uncover what was true and what was snake oil or what was placebo. Because for me, I got into it and read about 20 books within the first 3 months of school on placebo medicine to figure out what's natural, what's real, what's not real, what makes sense. And so my journey was starting out trying to avoid the medical system and do natural medicine because I didn't want to just prescribe drugs. I wanted to get to the root cause of the problem. And then I really dove deep into the natural medicine schooling community, way more than most of my peers, in order to help people on a deeper level. And so now I bought a practice right out of school where I spend an hour with most patients to begin with. And then usually it's half hour to an hour afterwards for follow-up visits. And I usually see people every 2 or 3 times, get them better, and then send them away. My goal is to not see people forever. It's let's figure out what's causing this, do a really good history, a really thorough exam, do some tests, find out what's wrong, give you a protocol that you can become empowered to be your own doctor, take care of yourself, get yourself better, and then see you later. I would solve the next puzzle. I love people. I love seeing people regularly, but the goal is really to just figure out what's plaguing them and then send them on their way.
So is what you just described in the last kind of minute or two what you mean by Robin Hooding healthcare back to the masses?
Yeah. So the Robin Hooding healthcare came after being in practice. So I've been in practice for 7 years now. So right out of school, I was like living my dream. I bought a practice. I was helping people on a deep level, getting to the root cause of their problems. And I then decided to finish up all the schools I had. I wrote a book because the doctor whose practice I took over for was always said like he would write a book to explain how he saw the big picture of people's health problems, because he also did Eastern and Western and Ayurvedic and homeopathic medicine, things like this. So I basically wrote his book of what I had learned from my mentor. And then I didn't know what to do. So I started a nonprofit. And the goal of the nonprofit is to Robin Hood healthcare back to the masses. So basically I started to teach online for free, give away material that was free for what cost me hundreds of thousands of dollars to learn, or you have to like join this exclusive membership or do this training for 6 months before they'll start teaching you like all their secrets. I'm like, that's bogus. I don't like the idea of like, why do you have to become a black belt in order to learn how to do the best Qigong practices? Why do you have to do this in order to learn that? I just thought if we could just teach people how to actually care for themselves, I figured that people would see it, value it, and share it with others, which ended up being true. We had one of the, so basically I just started a nonprofit to teach this material for free to people and inspire them to be their own best doctor. So I've been doing that for the last 2 years, and then the pandemic started. And so we were helping people with the pandemic, and yeah, just been inspiring people to be healthier still ever since.
Awesome. So one of the things you talk about is the fact that people don't necessarily understand fully or don't have the big picture of the pharma industry and the medical system. So what should they be aware today that they're not necessarily?
There's been a lot of people in the US at least who are starting to wake up to it, because for better or worse, the pandemic has politicized a lot of healthcare. So there's been like a big divide of how the pandemic was handled between Republicans and the Democratic Party here. But a lot of people are realizing that modern medicine is not super great at treating complex illness. And it's a lot better at either giving you something to feel better or helping in an acute crisis. So if you cut your finger off, you're not going to go to an acupuncturist. If you are bleeding from your head or you have a stroke or a heart attack, you're not going to go to the chiropractor. So natural medicine is amazing. It's the original medicine. Natural medicine is not really alternative. It's just the like medicine that we've had for hundreds or thousands of years. Herbal medicine is where most of modern medicine came from. And it's profoundly healing, but it's very slow. So I think the thing a lot of people don't realize is that natural medicine really does work. It takes hard work and consistency with lifestyle change, because you have to stop putting in enough toxic influences into your body and start nurturing and supporting and allowing the healing to happen by removing some of the things that made you sick. There's a quote like, you may not be ready to be better because you're not ready to let go of the things that got you sick in the first place. So a lot of people, they want to heal, they want to get better, they want to get rid of their chronic diseases, they want to get rid of diabetes or autoimmune disease or gut issues, but they're not yet ready to let go of the things that made them sick in the first place, whether it's alcohol or a nicotine habit or whatever that might be. They're not ready to work out yet to build muscle. It's like you can't really build health without putting in the effort. You can't really, no one would say, oh, that guy's jacked. How did he do it? He probably went to the gym a whole bunch of times. He might have taken steroids. He might have taken a quick fix, but the long-term fix is the ultimate one we all want. We want to be authentically healthy long-term, which takes hard work. So it's not necessarily the sexiest of medicine solutions, but the true thing that most people need right now is natural healthcare. Like modern medicine is great at saving lives. It's great at treating cancer now. For most cancers, it's gotten really good at dealing with a lot of cancer. It's great at many things, but there's this worsening of healthcare. And the countries like America and most first world countries that are spending the most on healthcare are having the sickest populations. So as we're spending more on healthcare, we're getting sicker, which doesn't make sense. So what that means is that modern healthcare, although it is amazing, it's not necessarily working in terms of the overall big picture of helping us heal, get healthy, and resolve chronic disease.
But why? What's the actual issue?
So the issue is modern medicine tends to use drugs or surgery to get people better, and modern medical training for at least medical doctors and most nurses and PAs and assistants, they don't have enough training in lifestyle medicine or natural healing. They learn about disease, they learn about sickness, they learn about how to treat disease. They don't learn how to cure disease. They don't learn how to induce a healing response, which is the main issue.
So it's the whole treat a symptom versus treat a cause, basically.
Correct.
Okay. Yeah. Give a pill to treat the symptom, and instead of basically looking at the underlying cause and going much deeper. And as you said, this involves doing lifestyle changes and taking a lot of time to understand yourself and what suits you.
And a lot of doctors actually know how to do that, but they don't have the time. There's almost a 25,000 doctor shortage in the US. So doctors have 5 to 15 minutes to get someone better, but it often takes a couple hours of getting to know somebody to really learn and be like a health detective to figure out where that root cause is. So it's not that doctors are like malintended or don't have the skills. It's just the system with the insurance-based networks that they have often doesn't even give them the time to ask about someone's childhood or their antibiotic history or whatever else could have caused it.
Is it only purely a question of time, or is it the system that's built so that people consume these drugs because there is a lot of money to be made versus this kind of natural medicine where there is money to be made, but probably much less?
Both. Yeah. So the system prevents them with time, but the system also doesn't allow most medical doctors in the hospital systems, which is where most doctors are, to prescribe natural remedies. They can't recommend brands that are not approved through a pharmacy. So they could say like on the side, hey, maybe get some milk thistle for your liver, but I can't tell you like this brand and this dosage and that sort of thing. They're like, just do this what this bottle might say. But if doctors get caught prescribing natural remedies, they often lose their jobs, which is not great.
So it's in the law that they have to prescribe actual drugs instead of alternative medicine.
Right. In their, like the code that they sign when they sign up to different hospital systems, they're not allowed to use natural medicine.
All right. Okay. So what is functional medicine? And is it similar to basically what when you're saying natural medicine, functional medicine, and what's the history behind it? And why should people, as you said, more and more people understand in the Western countries or in Europe or in America, but what is it? What's the history behind it? And why should people not only care, but actually start to think more seriously about it?
Yep. Functional medicine is a type of medicine that finds the root cause. So it's essentially a rebranding of good medicine. Like every doctor for all of time has tried to figure out why someone is sick. But functional medicine is essentially a rebranding in the last decade or two of good medicine to just figure out why someone is sick. And often there isn't one root cause, there are multiple root causes. So functional medicine is basically a training system, or there are multiple functional medicine training systems that are trying to reteach modern day doctors how to take a good history, how to do a thorough exam, and how to do more extensive testing to find true root causes for people. So it includes a history and exam that's more thorough, that takes more time with you, and you're usually going to have to pay cash to see a functional medicine practitioner. But functional medicine also, as a second part, includes lab tests that are typically not covered by insurance or that cost a little bit more, that are a little more in depth. So they'll do things like test for toxins in your body. Functional medicine doctors will look at your stool, to look at your gut flora, to look at bacteria that's good or bad inside of your gut. They'll do more extensive nutrient or hormonal panels that are more extensive. So most thyroid labs will only look at a TSH for thyroid stimulating hormone, but a functional medicine doctor will usually look at a full thyroid panel, which looks at 7 to 9 different markers to evaluate the immune system of your thyroid and antibodies. They'll look at reverse T3 or total and free T3 and T4. They'll look at the whole picture to see what's really going on inside of your whole body, rather than just narrowing in on one small marker and saying, oh, you're probably fine. So it's a much more fine, detailed sense of what's going on, rather than just like, you're sick or you're not.
So basically what you're describing here is pretty scientific and really not really in when you talk about medicine, or people think about acupuncture or Reiki or this kind of stuff. And they always think, if they're not familiar with it, they will always think that it doesn't work, or that you need to be spiritual or a bit weird for this. And actually, I live in Asia now, and these medicine come from Asia, most of them. Chinese medicine, Ayurvedic medicine. And a lot of people hear, a needle, are you crazy? And things like that. So what do you say? What do you tell? What would you say to these people who think that you need to be spiritual for this stuff to work? And actually, does it actually work? And what's the kind of science behind it?
Yeah, it definitely works. It works whether you believe it or not. Like if you get stabbed in the gut, it doesn't matter if you believe you're stabbed in the gut, you're going to bleed out like a stuck pig. If you put a little needle in someone's stomach, you're going to induce a micro experience of that trauma, and it's going to have an effect on your body, whether you like it or not. You're going to have blood flow to that needle. You're going to have nerve sensation that's aware of that needle, whether you feel pain or not. It's still going to do something to your body. Like people, if they don't see it, they don't believe it, or if they don't feel it, they don't believe it. And it's not that it doesn't work. Some people will try it and say, oh, that didn't fix my problem. So you either didn't do it right, or it wasn't the right thing for you at that time. It's like people say they've tried food. It's, I tried Mexican food, I didn't like it. Or I tried food from Singapore, I tried Asian food, didn't like it. That's being like a huge category of just like Asian food or just Mexican food. There's a lot of different types of Mexican food. There's a lot of different restaurants. There's a lot of different cooks and chefs. So just because you tried it one time doesn't mean it didn't work. It means you might have actually had to try it 10 times or drank coffee 10 times before you learned to love coffee. So it definitely works. We could talk more specifics about how acupuncture works, but
we'll talk about that later, actually.
Oh, great. Yeah, there's a huge breadth of research of why holistic medicine works. It's actually more scientific than most modern medicine. Most modern medicine, 50% or more of modern medicine, we don't even know how it works or why it works. And 30% of modern medicine actually is shown to be harmful or not work, but we do it anyways because it takes 20 to 50 years to change the medical profession. So a lot of things like scoping out a knee or doing surgery for your knee is shown to be no better than placebo, but yet we do it because it works, because placebo works.
Yeah. So the main issue with most people is they want a quick fix. And all this holistic medicine or functional medicine is the same as basically when you're trying different kind of diet, and it's completely linked. Everybody is different. So everybody will react differently to different things. So you have to do some trial and error until you find the food that works for you, or whether it's acupuncture, whether it's Reiki, whether it's whatever else. And that's something that you need to be naturally very curious, maybe a kind of a little entrepreneur to go through that. Otherwise, most people will just go, I'll try acupuncture. I didn't really feel different. I'll try. It cost me. It's not taken by the insurance, etc. So that's one of the biggest challenge today for this stuff, because most people just don't have the patience or the curiosity to go through this process, which once you go through that is definitely life-changing. Because I'm a big fan of all this stuff. I take a lot of herbs since many years.
Nice. Yeah, it definitely works. Like people will say, oh, vitamins don't do anything. Or some doctors still, even now, will say, oh, vitamin B, that's just expensive horse pee. Like
Mm.
you're just going to pee out your B vitamins. But it's like, no, B12 deficiency will cause anemia. And if you take too much of certain vitamins, like the fat side ones, vitamin A, D, E, or K, it will kill you. So you have to be careful with some vitamins and use them responsibly. And certain herbs and overdoses will create toxicity. So they do clearly do something. It's just modern medicine usually teaches doctors that vitamins are worthless, they're not worth taking, they're unregulated, it's unsafe, or that they're ineffective, which is the farthest thing from the truth. There are tens of thousands of research studies. They're just not taught to most practitioners.
So until now, we talked mostly about kind of physical problems, but I'd like to dive deeper into mental health. And because you talked about COVID and how you basically started helping people online, I guess a lot of that was around mental health. So what's your definition of mental health first? And what should people understand about that? Let's take someone who has zero self-awareness, basically, which is still a case of quite a lot of people out there. So what should people understand about mental health? And maybe talk about self-awareness and how it relates to mental health.
Yeah. Mental awareness and self-awareness, mental health. So I would say for most people, the best way to think about mental health is being happy or accepting of your thoughts, your feelings, your emotions, your spiritual beliefs. If you're happy, if you are waking up in a good headspace with positive thoughts most of the time, and you don't have to be happy all the time, but if you feel fulfilled, you feel successful, like you can create the life you want and you can feel good about yourself and the space you've created, that's a good sign of having a good mental health. But things like anxiety, depression, feeling sad, unmotivated all the time are not healthy. They're not normal. They're common, but they are not normal. And we live in a sick society where people are mentally unwell and they're struggling and suffering. They have low self-esteem, they have anxiety, they have depression, they have low mood, they have sleep issues, and they're really struggling day to day. They're worried all the time, they're overthinking, they're comparing themselves to others, and their mental health is in the gutter. So it's common, very common for people to have a poor mental health these days and physical health all around. It's almost glorified in some of the entrepreneur community to face your mental health for performance or for this hustle culture. And it doesn't have to be that way. You can work hard and work smart and feel good and feel amazing in your own thoughts and your own feelings and emotions. But we're not really taught to process our feelings or emotions or taught how to think correctly about ourselves in the world. So we end up with a pretty sick society.
Yeah, and you're saying we're not taught, but even I'd say even one kind of step earlier, one of the main issue is, again, back to self-awareness, is a lot of people feel they're not doing good, but they don't know what's happening. Like they don't know until late that, oh, I can put a word on that. I have anxiety or I have some depression. Or so for the people listening out there who don't feel good or who haven't been feeling good for a while, what would you say is, I don't know, a few key things that people can do to develop more self-awareness and actually realize or put a word on, this is the kind of challenge I'm facing or issue I'm facing. And then obviously afterwards, we're going to talk about potential solutions.
Yeah. Symptoms and symptom quizzes are one of the ways that I developed through the Robin Hooding in our nonprofit to get people to have more self-awareness. Because if there was one magic pill I could ever give everybody, it would be more self-awareness to figure out who they are, what their strengths and weaknesses are, how their body's talking to them, which is the main thing. So symptoms are not necessarily a bad thing. They're just the way your body communicates with you to try to get you to understand what's going on. So things like high blood pressure or low blood pressure, where you stand up and you get a little dizzy or lightheaded, having low energy throughout the day, things like having low motivation, not being able to focus, are all really good beginning symptoms for gaining self-awareness around having some mental health struggles. One of the best ways to ask people how they're doing is not just walking up to someone saying, hey, how's it been going? It's ask someone how they're sleeping, because sleep is mostly regulated by your unconscious or your subconscious, where your mental health truly is. So if someone's waking up in the middle of the night or unable to fall asleep or not getting enough sleep, or not, they're waking up early, or they're waking up at 3 a.m. and not sure why they're up, or they're waking up to pee 3 times in the middle of the night, that's one of the best self-awareness tools to tell you your mental health is starting to suffer and you might not be consciously aware of it yet. But if your sleep is starting to get a little dysregulated, that's my first early red flag. If there's something we need to start looking at in your mental health.
So you said basically we're in a kind of a sick generation. So what are the common mental health challenges that our generation faces? The most common ones?
It's got to be anxiety and depression are the most typical labels, and insomnia. Those would be probably the big 3. The reason why those happen is because generally there is a really low sense of self-esteem. There are people who are trying to live a life that they think they should live rather than living the life they want to live. They are attached to materialism rather than what truly makes them happy. They're trying to live a life that's not sustainable. And what that means is that they're basically working way too hard and resting way too little. They're putting too much energy externally into car, money, house, finances, rather than all doing that, but balancing it with the internal work to work on themselves, to practice some self-meditation or some introspection, or spending more time alone or in nature and working on their internal body. So it's one thing to like physically look good. It's another to internally feel good in your heart, mind, body, soul, spirit, your thoughts. It's one thing to have correct actions and to show the world that you're a good person. It's another to have correct thoughts. One of my biggest spiritual lessons was learning that it's really easy to say the right thing, to say positive things, but if you're not thinking positive things, or if you're having dirty or corrupt thoughts, or you're having really negative thoughts about yourself internally that you're not sharing, that's the true level of spiritual growth happens when our internal world is the world we share externally.
So basically you would say that the main reason why our society is sick is because there's a mismatch between the actual values that people have internally and the actual lifestyle that they live.
Yes. Yeah, there's a huge mismatch, and it's an inauthenticity of not wanting to be vulnerable to show what your internal state is doing externally, not asking for help, not being willing to say, I have anxiety, not being willing to set boundaries. But it's basically people have learned that it's not okay to share their internal state, especially the dark, evil, bad, shadowy, uncomfortable, sad, blue, down, worried parts externally with the world. We're not allowed to talk about them. We're not allowed to express them. We're not allowed to feel them. We're often taught to shut it down, to just go to work and not actually process our deepest internal states.
Okay. So you'd say that it's because people cannot communicate what they feel, that they don't feel good, partly, or it's because everybody, or most people, pretty much everybody has some sort of trauma, and we can define what a trauma means in their childhood, that they need to basically resolve and that they don't necessarily work on because they're not self-aware and they don't even know they have it, or because, as we said before, they kind of realize they have something, but they're not ready to work on it.
Yep. Yeah, that's perfectly said. It's basically, it is because of trauma, either known or unknown. The first step to healing anything is awareness. So once you have the awareness that you've had some trauma, or you take, it's called the ACEs score, the Adverse Childhood Experiences score. You can Google ACEs and take the score to see how many basically traumas you had as a child. That could be a move, that could be your parents splitting up, that could be being bullied in school, that could be the loss of the death of someone close to you. There are many different traumas we have that people might not identify in their conscious awareness as a trauma, but there are a bunch of traumas in that ACEs score that will say, oh, you did have a hard childhood, or you did have some things that would have caused some trauma. So it is trauma related. It's also at its core a lack of self-love and giving ourselves enough time and space to talk about and heal a lot of this trauma. If we have more community, where community can hold space and help us feel loved, at the end of the day, the love is the healing essence that we all need, either from ourselves with self-love or in a community. And we don't tend to have as tight of communities, whether it's like churches or groups of friends or school, where people can pour out their souls of their trauma to say, my brother died when I was 5 years old and I'm still sad about it. And someone can come and just like hold space and listen and heal. And those type of group healings, whether it's our church or a community or friends or family, are profoundly healing. And we're living in a society where that is no longer common practice.
All right. So can functional or natural medicine help people heal trauma, anxiety, and depression? And if yes, how?
Functional medicine itself can help you. Most functional medicine is working on the physical level of health or the biochemical, physiologic level of health. So it's looking at chemical imbalances or helping you with hormone levels or helping you with vitamin levels. And that will increase your resilience. It'll increase your adaptability to stress. Like taking adaptogenic herbs will help you adapt to stress better. But most functional medicine practitioners are not actually trained in healing trauma. I've done lots of other training to learn how to heal trauma. I'm taking more training this year to learn even deeper levels of helping people heal their relationships with themselves and others through trauma. But usually what you need is some sort of mind-body healer. And that goes beyond traditional therapy, because traditional therapy is just talking about your trauma or talking about your feelings. But to truly heal, you have to do some sort of body therapy. The issues are in the tissues, we like to say, and you have to feel it to heal it. So that means you have to feel the feelings. Sometimes when you're in therapy, you'll cry, you'll have an emotional experience, you'll feel it, and that is healing. But if you're just talking your way through therapy and you're not actually feeling the experience, it's not going to leave your body. So in order to fully let go of trauma and heal the trauma, you have to feel it to heal it. And that can happen in therapy, but it often happens in specific trauma-based therapies or certain body-based healings. Sometimes that's Reiki, sometimes that's acupuncture. Acupuncture is a very useful tool for healing trauma. There's something people can research called NADA, N-A-D-A. It's the National Acupuncture Detoxification Association. They have a NADA protocol that is 5 needles in each ear that's used after major traumatic experiences, hurricanes, disasters, your house burns down. What do? You can get acupuncture in your ear up to once a day for 10 days, or just even a few times. And it stimulates your vagus nerve because the vagus nerve innervates your ear. It's the nerve that controls your ear, but basically just resets your fight or flight nervous system to help you relax and process the trauma better and gets you into a resting, digesting, less stressed out state. And it's one of the most profound tools that's very cheap and effective for helping just get you out of that stress state right away. But trauma really has to be healed through the body rather than through conscious thought.
All right. So basically you're saying that recognizing where the issue comes from is important once you're in the process basically of healing. But you're saying that the actual key to healing is to focus on the healing itself and not the disease or the kind of cause. So why is that?
Yeah, it's this weird paradox of you have to find out the awareness or the diagnosis of what is the root cause or what are the root causes. And then you almost have to let go of it at the same time. And you have to allow the body to heal itself. You have to not put in offending things that will stop you from healing. If you're trying to heal your liver, you're going to cut out alcohol as much as you can. So you remove the offenders and you add in things that promote healing to the liver. You add in things that promote healing to your organs or your body systems that are under functioning or underperforming or requiring of healing. And then you allow yourself space to process emotions, trauma, and all the other factors that are weighing you down. At the end of the day, the diagnosis is really important, but you treat the person, not the disease. And the person heals by clearing stress. The person heals by eating better, sleeping better, moving better, thinking better, breathing better. And the person heals by figuring out what for them is their biggest health challenges, and mental health challenges are what is their biggest stress. And 80% of the reason why people go to the doctor is because of stress. but doctors are not directly treating stress. So when you see an acupuncturist or you see someone who has a technique where they're able to treat stress and treat your subconscious or your unconscious thoughts or feelings and emotions, that's where the true miracles happen in practice, where things that should not be cured are cured.